Welcome to Raleigh Roots, a podcast about living, working, and raising a family in the Triangle. Join hosts Kate and Catherine for lighthearted conversations, stories, and interviews about what it is really like to live here. Whether you're thinking about moving to the Triangle or have already planted roots here, tune in and listen on your favorite device. And now your hosts, Kate and Catherine.
Hi, Raleigh.
Hello. Welcome back to Raleigh Roots, my favorite Raleigh peeps.
We have an awesome episode today. We are interviewing a fantastic OBGYN in the area and asking her all about perimenopause, menopause, postmenopause.
And y'all, it's going to be good, real good. And we're going to be asking questions that you may not particularly feel comfortable to ask. And she is going to give us all the scoop on better ways we can maybe cope. How our friends and significant others can maybe cope being around us. Some medical questions, personal questions, emotional, physical. We've got a lot. So this is episode 8. Thank you for coming back to listen and watch. And let us know at the end of this what you think. Any questions? We are excited about this episode.
Yes, so enjoy.
We promised we were going to have the most exciting guest and knowledgeable about a super exciting topic. Menopause, which we are all in, I think.
Well, no, perimenopause.
Perimenopause.
Postmenopause.
And so now I'm going to introduce the most knowledgeable OB doc ever, Dr. Felicia Cuthbertson. And she was formerly Dr. Flanagan, but she is here in Raleigh. And I'm telling you, I do have to call her on occasion to ask all kinds of questions to make sure that I am not abnormal. And she is awesome and always answers the questions, in most cases embarrassing. Just let's call a spade a spade. So let me tell you a little bit about her history. She has been a doctor for 24 years. She went to Peace, so she's local, then to EC Medical School, and then to the, help me, Virginia Medical College of Virginia. And I bet she's delivered your babies.
Oh, I bet. Yeah, that's true.
Yeah. And
It's pretty neat.
I mean, there's not a better guest, right?
We might need a series on all of this because I realize it's a
It's
lot.
a lot.
Because
Yeah.
some of my questions are pertaining to postmenopause, not just perimenopause. So did you always want to be a doctor?
No, I went to pharmacy school for a semester and then decided that was not for me.
Okay.
And then went back and then eventually decided to go into medicine thinking I was going to go and do family practice in a rural area like where I grew up in North Carolina. And that was not for me, but I liked operating and I liked the idea that when you take care of women in this situation or any times in their life, if they've got a problem, they're going to do what you suggest because they want to fix it.
Right.
So they listen to you. Plus, there's also things where if you're dealing with something, you're going to fix it or it has an end. Pregnancy, delivery. You know, if somebody's having abnormal bleeding, we fix it. You know, that type of thing. That's what I like about it.
Do you think you'll always deliver babies?
Probably.
Yeah, I think that's pretty awesome.
Yeah, it is. It is.
Yeah. Well, and you've got a good personality for it. And you've lived in Raleigh for
Back 20 years, just for undergrad, and then back for 20 years at Wilkerson.
I think I told you all today is National Hot Flash Day.
I love that. So we're recording. This will not post for a little bit, but
On
it
the
is
night.
a very
Appropriate.
appropriate
Mhm.
thing.
Happy
Love that.
National Hot Flash
Hot
Day.
Flash Day. And I'm sure in honor of it, I will have one tonight. Okay, so we are just going to jump right in because we have a lot of questions. Tell us exactly what is menopause?
So menopause is when you stop making estrogen, okay, from the ovaries,
Okay.
but it's once you go a year and you have not had a period, which means that you're not producing estrogen,
Okay.
then you are in menopause. Okay. The
Mhm.
prior to that, it's kind of a stop and start kind of thing where women who are not on any kind of other hormonal birth control will usually skip some periods in there as leading up to.
Okay.
But the average age is 52. And so
Of
there's
menopause?
but there's
Okay.
definitely
Yeah.
a range. And so, you know, this is something that we didn't talk about a whole lot for a long time. And we didn't learn a whole lot about it I didn't at least, learn a lot about it in residency. And now it's become something that is talked about everywhere. So women are noticing, okay, I'm having these symptoms in those years prior. Is it due to this? It's become something that's definitely more talked about. So there's perimenopause, but really you're menopausal once you go that year and don't have a period. And that is important from my standpoint, because I mean, it's unlikely that at 50 you're going to get pregnant. I can't tell you,
Woo, child.
I know.
I can't tell you that you're safe until you go that year. And so someone who's had their tubes tied or their
That's
partner's
me.
had a vasectomy, then, they start skipping periods and you're around 50. It's kind of like, okay, we know what's going on. And you just kind of wait and see. And then you base, which I'm sure we'll talk about later, but you base whether somebody needs to be treated on how bad their symptoms are.
And that can range depending on the person. You
Mhm.
could line up 20 people and they're all going to have a different level of symptoms or different types of symptoms.
Correct. And some
Okay.
people will say that it's kind of like what your mom went through,
Mhm.
but that's not written in stone, but you can kind of get an idea.
Yeah.
But definitely there's women who go through it, if they go through it really early, like 40
Okay.
or something like that, that's called premature ovarian failure. So that's a little bit different. But the majority of women, if they're not having any issues, is going to be somewhere around that 52 mark, probably more before and maybe some people after.
I was wondering, I have had conflicting discussions on this, and I'm curious.
Mhm.
So I had once heard before that, with each child you have, it can delay menopause
Mhm.
because you don't release an egg for however long you're pregnant. So my 4 children potentially could make me a little later. But then I did tie my tubes with my daughter.
Mhm.
And then I had a different doctor tell me that I might start sooner because I did that.
Okay.
So it was like, it doesn't really matter. I'm sure it's all still a range, but
Mhm.
I thought it was strange that those
It was such
comments were out
different-
there. Yeah.
So if someone has had surgery and had one of their ovaries removed, then they may go through menopause a little bit earlier than
Okay.
they would if they had both of their ovaries that were both producing hormones. That means, again, not set in stone, but
Yeah.
something that could happen. The amount of children that you have shouldn't affect it, because we're born with however many eggs we're going to release. They're already in our body when we're born. But that
You
doesn't.
didn't? It's okay. You learned something new.
But
I did go to college.
but the the number of children shouldn't affect that.
Okay.
Now, the one difference in that is that just from my experience, again, this is nothing that, I have no data, no
Mhm,
studies or anything
mhm.
like that, but I have a few patients that have had to go through in vitro fertilization to get pregnant. And it seems like the time that they go through menopause might be a few years earlier, nothing drastic, a few years earlier. So it's just something I've noticed. I don't know for sure if they're related.
Okay.
Are there some women that will never go through it?
No, you're going to.
Everybody goes
Every
through it.
female.
I wanted to be on that list. I never want to be the exception, but that sign me up, people.
Well, I think I told you about that. There's a documentary on PBS called The M Factor. And
Okay.
it's all about menopause and stuff like that. And one of the ladies, like one of the first things that you see when you watch the trailer, she goes, the one thing that every woman is going to go through is menopause.
Is menopause,
Yeah, I was
no
like,
matter
there we go.
what.
You can't
Sorry,
avoid it.
ladies. Well, and so how long can it last? I mean, what's the general time frame?
I think it's a little bit different for everybody. What I've seen from my practice, because I have a lot of women in their 40s, early 50s right now. It seems like, again, if they're not on any hormonal birth control, that the time leading up to that 52, even before they start skipping periods, seems, if we pinpoint when they're having symptoms that bother them,
Mhm.
it tends to be at the point right before their period where their estrogen levels
Yes.
are less.
Yes, it's me. That's
Yeah.
exactly it. I've noticed a big shift where it used to be I was so fatigued, lethargic, just dragging until I would get my period.
Mhm.
And recently, over the last year or so, it's been I can't sleep, I get wired, I have insomnia, I'm edgy and just cranky, but it's
Mhm.
completely flipped.
Yeah, and I can't explain that. But if your symptoms are truly from the lack of estrogen, then there should be a time when it's worse. Now, if you're having those symptoms all through the month, there's probably something else besides approaching menopause that's
good to
going
know.
on. And
Okay.
that's, our season of life and, the craziness that goes on in our lives. Yeah, exactly. And so are those things causing symptoms that can be very similar to things other than the vasomotor symptoms? The vasomotor symptoms are your hot flashes and your night sweats. Yeah, those are definitely due to the lack of estrogen. And that's kind of what hormone replacement is supposed to treat. Okay. Because it's replacing the estrogen. But kind of secondary to that, if you are lacking estrogen and you start having vasomotor symptoms, it makes sense that then you're not sleeping, then you're irritable, and then you can't concentrate, which people consider brain fog. And that, it's like all the
And
other
you
things
never
kinda
know
come
what
back.
starting it and what is the ripple effect, right?
And that's why I said that if you're around that time and you're trying to figure out where your symptoms are from, sometimes it's a little bit of trial and error and put somebody on some type of estrogen, and depending on kind of where they are in the process, what that is, but put them on some estrogen and then see if the symptoms decrease.
Right.
And if they do, then yeah, that's what it is. If I have a patient that I put them on those things, but they still keep having the irritability, the insomnia, all that stuff, I can't say that that's truly perimenopause because it has nothing to do with hormones, because I'm giving you back the hormones that you need.
And so some of this it's trial and error, right?
Yeah, it is. And it's very gray.
Can you get a blood test that'll say, I am in perimenopause or I am
Not really. Well, we can test those, but when I get the results, I can only tell you where you are at that moment. Okay. Because remember I said they kind of come and go.
Right.
So if I checked it on a month where you're going to have a period, they may be completely normal, or not menopausal, right? So it's a little tricky. I think one of the biggest things that y'all probably heard about is like bioidentical hormones,
HRT.
and what I find is that patients are either getting hormone replacement from their OBGYN or from a functional medicine
So it's
physician.
it would be safe to say then for all of us that potentially might try HRT, that it's kind of also one of those things where you're going to test something for a little bit and see how you feel and then test again. And it's not just all of a sudden, oh, you're great, right?
Now, and I always go to the fun stuff, you know me. Can we please talk really quickly about if you have night sweats and you wake up, which by the way, I am having them, and it's so weird. I'll wake up and the inside of my legs, y'all, are so wet. I know
It's
that
like to touch your skin. It's hot.
It's so weird. It's
weird.
gross. And I'm like, I cannot take this. But you personally have told me about something I did not know about. And y'all, this is, I don't have it yet.
It's amazing.
I've heard it is a game changer.
This is called the
Chili Pad. It's by a company called Sleep Me. And one of the other female OBGYNs told me about it. And when my night sweats got bad, I was like, I've got to do something. And in addition to starting hormones, it is a pad that lays under your sheet, and it has water flowing through it, and you can control the temperature. Now, you can make it cold, but you can make it hot. To me, it's my most prized possession right now.
You cannot put a price tag on waking up and not being drenched.
Oh my
in
gosh.
sweat. I mean, you hear ladies that are changing their shirts 3 and 4 times a night, right?
I am wearing long sleeve and long pants pajamas, which I haven't done in years.
Right.
Wow.
And some people say they feel like they're burning from the inside, right?
Well, that's what a hot flash. I know the difference only because it's like somebody comes inside of you with a fire poker. It's not like you get hot and start sweating.
Yeah.
It's all of a sudden, and you can't stop it, and you can start feeling it radiating all through you, and there's nothing you can do.
And if you're someone who gets red, then it
I do too.
embarrassing.
Yeah,
Right.
I do. I get real flushed.
So we're going to link this chili pad. We have no ties to this thing.
No, at all.
Hey,
but
chili pad, send us one.
I know, but I've heard it's really awesome.
I'm like, I have got to get one. So that's next. Maybe I'll ask my kids for that for Christmas.
There you
They'll be like, that's too expensive. What is it for? I'm like, it doesn't matter. Just get me the chili pad.
Well, what can you do to make your sleep better? It's what we call sleep hygiene. And I think that if you're having hot flashes, then anything that you can do to make yourself cool. Now, I will hear patients say that their partner complains because they keep it so cold.
Right.
When it's not bothering them. So, of course, decreasing the temperature is one thing. The sheets that are supposed to be cooling. I think that the silk pillowcases are supposed to be a little bit cooler. They have the pajamas, you know, it's like all those things, but also, you know, making sure your room is really dark. You know, do you need to take like a little supplement like magnesium or melatonin to help with your sleep too? So sometimes it's like it's hot flashes, yes, but it might be a step into what else can I do to make my sleep better?
So let me say, men, what can I do to save myself and my family when my wife is in menopause or my, you know, significant other? Buy them a chili pad. Number
Yes,
one.
there you go.
Okay.
That's our number one
That's your number
suggestion.
one solution for now. And then that way you won't freeze yourself out of the room.
Exactly.
You hear
Yeah.
some men,
I
they're
mean,
like,
you can get one to keep it warm beside you.
That's
You can
right.
get two
You
in the
could
same
get
bed.
two.
that's right. Yours can be hot, hers can be cold. That
Just the knowledge of what it's happening to a woman's body during that time.
Yeah.
And that it's not just something you just scoop through. There's a lot of changes.
And
Now, there are some women who just, you know, do just fine
Right.
and aren't really affected, but for most women, they are.
this stuff is real. So, okay, men, chili pad, number one. That's your first type. I bet you that'll be the best present you've ever given.
Absolutely.
Oh,
It's like
they're
that
having
will
hot
make her
flashes.
so happy. The symptoms of perimenopause, do they go away after you're in menopause? No, so they're just forever.
Everybody's different. Everybody's different. Right. So it's kind of like builds up is what I've seen. Right?
Okay.
And then like when you're really like, okay, they're not working anymore, it may increase your symptoms a little bit. With time, they may come down. But I have patients that are, you know, 60 and they're telling me they're still having hot flashes. You know what I mean?
Oh, somebody help.
Okay.
I think the bigger thing is if you're in that process and you are miserable,
Mm-hmm.
then that's the person who needs hormone replacement.
Mm-hmm.
Now, telling how long is really, again, a trial and error thing. So say somebody's been on hormone replacement, they're doing great for like 2 years,
Right.
and they're like, well, maybe I don't want to be on it anymore. So they come off of it for a couple months and you see, you know, if they have hot flashes or night sweats, and which they're probably going to have pretty quickly if they're still present,
Okay.
you know, and then you just start it back. So
It's a journey. It's a journey.
It is very much.
Y'all,
is,
I don't
yeah.
really like journeys. I like really quick. Here's the problem. Here's the answer. Here's how you fix it as you go.
Yeah.
I'm like, give me the quickest fix. And a little fact is, if you are on birth control, you really don't know if you're in perimenopause or menopause because your birth control is already
replacing that.
Well, yeah, it's
the
keeping your
estrogen
hormones.
that you need.
Yeah.
Yeah. And speaking to that, so those women who are kind of before 52 or 50, and they're doing that on and off of their periods. What I found is that if I put somebody on hormone in that situation on hormone replacement, which the doses are different than birth control, and they tend to have kind of crazy bleeding. So I will usually recommend to those women, unless they have a contraindication, to use like a really low dose birth control pill, and kind of does the same thing.
Okay.
And then when we get to 52, we try to say, okay, come off of it. Let's see what happens.
Yeah.
And then it may be that you change to hormone replacement.
Okay.
But now, if you've had a hysterectomy, then you're not going to, I mean,
you go into menopause, right?
Yeah. Tell me about that.
Okay. It depends on if you have your ovaries or not.
Okay.
So the uterus, which is the hysterectomy, being gone is just going to keep you from bleeding. If you still have your ovaries, then they're still producing the same hormones. They're releasing eggs. They're doing all the same things until you get to whatever place it's going to be in your life that they stop working.
Wow.
Pretty
I
much.
didn't know that.
Yeah. So people will call it a full hysterectomy if they think that like the ovaries have been removed, but it's actually two different things. It's the uterus being removed as a hysterectomy, but the ovaries and tubes are called a salpingo-oophorectomy.
Oof.
Yeah.
I'm gonna not even try to repeat that.
So
Right?
if someone has a hysterectomy and they have their ovaries removed at the same time, boom, they are in menopause.
Right.
And so say somebody's had a hysterectomy, they still have their ovaries, then they get to like 50 something and they start having hot flashes and night sweats. Then it's kind of like, okay, well, now we know that you're in that process of them not working great. But for someone who does not have a uterus, you only replace estrogen. So the progesterone is to protect the uterus from the estrogen causing abnormal cells inside the uterus.
Okay.
So it keeps the keeps everything thin so nothing builds up.
Okay.
For lack of a better word, builds up.
Okay.
But and it
Oh.
can become abnormal. So if you don't have a uterus, it's just estrogen. If you do have a uterus, it's estrogen and progesterone.
Wow.
And are most people getting a hysterectomy because of excessive bleeding or?
There's a lot of that, fibroids, things like that. We have some more, some procedures that we do a lot more than when I started practicing.
Okay.
That will control bleeding very well. And so I don't know the numbers, but I would think maybe there's less people actually going to hysterectomy
Okay.
and more doing like an ablation or something.
Yeah.
Like that.
I've been thinking a ton about the stage of life. And I swear, I feel like I'm back in middle school. You feel awkward. Your body's doing weird things.
Mhm.
I mean, if you look back and you think about it, before puberty, you're just living your life, having a good time. Everything's good. You're level, and then the next thing you know, these hormones start coming and, it's confusing. I remember being confused and not being happy. And my daughter is currently in 6th grade and she has days where she's crying and she doesn't know why. And all this is happening with
They're
her.
like, buckle up, sister.
But at the same time, it's so reminiscent now in middle age because we acclimated to puberty and you have this different purpose, right? Now, all of a sudden you can get pregnant and you can have babies if you choose to do so. And then we're on the way out of that purpose. It's really strange, but it is like happening again.
And
Middle
I feel
school,
like-
weird.
I feel like that's a good comparison because, you don't know exactly what to expect. It's
Right.
very unpredictable. I mean, even if you're only talking about the bleeding, for some women, it's quite unpredictable. And, you have plans, you're going on a trip, you're, doing things and you don't know. You're like, I don't know whether I'm going to get my period or not,
Right.
I cannot take the credit for this. It was on a reel. A lady named it cougar puberty.
Oh, I saw that.
And I was like, that
Okay.
is spot on. We are in cougar puberty. And I'm like, that makes sense. It's so true. So true.
It does.
That
It's
is great. Yeah.
It's a different time. That's
Yeah.
for sure.
Yeah.
Yeah.
And so if any of my son's friends or my kids are listening, now is the time to cut this off. And if you see my son moving out because he's humiliated, please come pick him up and let him live with you. But one of the real things that I think and I don't think just for a specific person, but vaginal dryness is a really real thing. And I mean, that's uncomfortable. And a lot of people don't want to call and be like, hey, doc, help me out. I hear from spouses or in a dating situation because the men are like, what am I doing wrong? Or the woman's not attracted to me anymore. Or personally, a lady may feel like, oh my God, there is something wrong. And I think it could cause emotional issues, physical issues. So tell us how often you hear that and a solution or what may work for someone that is helpful because that's not fun.
So, I think it happens real often. And in my experience, it's when you're menopausal. And it causes problems. You've got discomfort when you're having intercourse. Then on top of that, you feel just yucky.
Yeah.
You don't know when your period's coming. You're moody, you're all this stuff. And the last thing that you want to think about is having intercourse. And then if you have intercourse and it hurts, who's going to want to have intercourse? And that does start to affect relationships. And I think that's explaining it that way and a woman explaining that to her partner, being like, okay, this is all the stuff that's going on and really making sure they know it is not them. I think that is key. The biggest thing is vaginal estrogen.
Okay.
Yeah, vaginal estrogen.
Like a topical?
It's a cream that goes inside the vagina, over-the-counter yeast infection medicine. So you can do that.
Okay.
There's a pill that
I'm
you
learning.
put in the vagina, and then there's a ring that you can put in that lasts for 3 months.
Was that like the birth control ring?
It's a little bit different. I mean,
Okay.
it's same concept. It's just shaped a little different, that kind of thing. But
does a doctor, you go and have a doctor? Oh, you can get it
yourself. Just like the birth control ring, you put in and take out yourself.
Okay.
Yeah, I was
it
gonna
works
say.
right there. So you can do hormone replacement, but I have found that it doesn't necessarily cover the vaginal symptoms.
Okay.
And it makes a big difference.
I
And so,
bet.
because when the lack of estrogen makes the tissue inside the vagina kind of thin, and it just doesn't give, you know what I mean? And so it can feel
Great.
I'm full of good news. Huh?
Tell us, sister. But this is the stuff that people want to know, right?
So it becomes like people will say, I'm not, that they feel dryness, but it's more irritation. But yeah, it can really interfere with your quality of life, your quality of your relationship.
But you also, I think, had mentioned that oil.
Yes.
Okay, come on. Like,
what I've heard from like some pelvic therapy people, it's that's the best lubricant, and it's quite natural. But that's a lubricant if you need something, but you don't want to use vaginal estrogen.
Okay.
So definitely use that. But patients who are using vaginal estrogen, I think it's a good idea that the times when you are having intercourse, you still use the coconut oil in between the times that you are using the estrogen.
And does it matter? Just regular old coconut oil. You can.
I haven't heard anything different from that.
I mean, it is antibacterial.
and hey, the smell.
Yep.
Tropical vacation for all.
Let me go back to one thing about the vaginal estrogen. I have a lot of patients that will say that are hesitant to use that because they have a family history of breast cancer or something like that. And so I think that's why I use the words more topical, because it's not complete hormone replacement. It is working right there. Is there a little bit that gets in your bloodstream? Probably, but not enough to say it's dangerous. Even so much that my colleagues that are oncologists and taking care of breast cancer patients are okay with us using vaginal estrogen.
That's wonderful.
That's been in the last few years.
Okay, that's big.
One of the best things I have seen recently is for breast cancer patients.
Okay.
There is a medicine that has no hormones in it, and it treats hot flashes.
Really?
Yes. It's called Veoza. It's like one of my favorite things. Veoza, yeah.
And is that
no? You have to prescribe it. Yeah, but it works on the heat centers in your brain instead of so breast cancer patients can still use it.
That is great. Well, that's good news.
If you want to stay completely away from it, but you're having hot flashes, Veoza and coconut oil.
Okay.
Would be the best things to use.
I mean, coconut oil. Oh, like husbands. All you have to do, chili pad and coconut oil.
Coconut oil and the chili pad.
Everybody, Christmas, birthday, that's the next present for your significant other.
Definitely.
Are there any supplements or anything that you would recommend for if somebody cannot do hormones at all?
I am not really knowledgeable enough to say this is good.
Okay.
There's definitely ones that have been out there that people have said it's good. And I'm not sure. There are some women who say that certain foods, or red wine or, things like that will make their hot flashes worse.
Oh.
So changing.
Yeah.
Don't be telling me that red wine makes hot flashes worse.
I think healthy lifestyle, exercise, of course.
Right.
Just a regular multivitamin, probably one for women,
Yeah.
It's going to have all your basic stuff in, but additional.
Yeah.
I don't really know of anything that I would say, oh, you should try.
Okay.
This.
Any type of certain exercise? I mean, do you think strength versus cardio?
Just move your body.
And move your body.
Yeah. There are people who are kind of delve deep into menopausal women and what they need. And there's definitely recommendations for weight-bearing exercise. I can see where that would be a good thing, more for your bones than anything else.
I was going to ask that.
So hormone replacement, putting back the estrogen when it's going to be gone on its own, is definitely going to help your bone health.
Right.
No question. Hot flashes and bone health. Definitely. There is some information about cognitive health. I was looking at something recently that did say that there's a time that you need to start hormone replacement.
Yes.
If it's going to help with cognitive health.
Genetically, I am predisposed. So I have studied that a lot. And there is a window where the huge dip in estrogen, if you are genetically inclined, could trigger dementia or the beginning of it. So they have done all these studies showing that it's protective, for the brain to make sure it doesn't have that huge dip. But how do you know when that is? I mean, that's my question.
Well,
how do I know when I'm going to have this huge dip?
Well, I think the best you can go is, again, by your symptoms. And if you're getting really bad, it's like, okay, let me do something. If you know that you're like, okay, I don't have any reason I wouldn't do it, and it's going to be protective for me, then, when you get to that point where it's like, okay, I got to do something, then go do that. the other thing is cardiovascular health. So that study that I was talking about that was like 20 years ago, they started women on hormones a long time after they had gone through menopause. And it was detrimental to their cardiac health. So I think that now, though, the thought is more, if you, again, start it when you're kind of going through the process, it may be beneficial. What I do is very gray, so there's not a lot of black and white,
Right.
but those are kind of things to consider when you're trying to decide if you want to.
That's a lot. I
It
mean,
is.
so estrogen seems to be the biggest role here. I mean, it feels like it causes dryness, which then I immediately think of my bones becoming brittle. And, it's just this breakdown. Like, it's so important.
Yeah. Well, there's a lot of changes too that y'all probably have heard about. Like, women will notice that their bodies are just different.
Yeah.
Like where you store fat.
Yeah.
Like the middle area.
I have every day, probably I have somebody complain about that. There are some women that will complain that their breasts get larger. It's the muscle tone can definitely decrease. Some people will talk about their hair.
Yeah. We talk about a lot
being dry.
Yeah.
One thing I have noticed is the dryness of my skin, which I have always had a very oily face. And now it's like normal.
Okay.
So I'm like, that wasn't a bad thing then.
So wait,
Yeah.
when you say that some people, their breasts get larger, well, when I gain weight, that happens, I'm just going to blame that shit on menopause.
There you go. Yeah. There
And
you
then
go.
I'm just going to keep
I
eating
used to-
cheeseburgers.
I used to think, I would wonder why I'd have patients like in their 60s that would get a breast reduction. And, once I was paying more attention to all the things that can happen, I'm like, oh, well, I mean, I guess I can see that,
Yeah.
if your breast size was something you were happy with premenopausal, but changed drastically when you're in a menopause,
Right.
that you may want to have something like that.
I've
done.
never thought about that.
Mhm.
Well-
I honestly did not really put the two together
And now
until
that makes sense. Yeah.
I have really been thinking about menopause
And
more
look-
and going through it.
Exactly. And look, if we go through all that, if
Mhm.
we want to have a breast reduction or a change, you know what? Go for it, ladies. Think about it. Our bodies go through everything in the world. And you know what? YOLO. You only live once. Do what makes you happy. I'm going to live by that motto. And red wine, if I have a hot flash, I'm going to just drink another glass of red wine and I'm going to get a chili pad.
and pop your estrogen.
And thank you for taking the
I
time and
know.
joining us today.
Yes,
Thank
enjoyed
you.
it.
This was great.
I mean, I like to
So,
talk about it.
yeah.
Hopefully it helps somebody.
Yes.
Absolutely. I
Yeah.
appreciate you taking the time. Well, Felicia was awesome.
Yes. So good. So good. And I love that you can ask her anything and it's just comfortable. And she has, not just a medical answer, but an everyday kind of normal answer. That's what I loved about it.
Yes, she was very knowledgeable. She explained things in a way that I understood, which I was very grateful for.
She did use one or two words that I'm like, I need to Google that.
I know, but good for her. I mean, she just came in after delivering a baby.
She did. She just delivered a baby, came in. I love that when I ask a doctor something, they can relate,
Mhm.
right? And
Yeah.
she's living it, right? She's been through it. She gets it. She understands the symptoms, which I think is so important. Thank you for joining us today.
Yes, and if you have enjoyed this episode, make sure you share it with a friend.
Yep. And you can also make sure that you tell people they can listen to it on Spotify, Apple, or YouTube.
Yeah. So have a wonderful week.
And if you're in menopause, you're not alone. Okay, Raleigh peeps, stay rooted and a little reckless. See you next time.
Bye.
Bye.